my low back pain, doc? Get this question a lot. If you need additional support with the back issue, number one, I'm going to go right to the spine. You have to have it properly analyzed. How are the messages from here getting to your low back? If there's biomechanical shifts, subluxation, damage, it's going to cause problems. It's going to cause pain. That's a good thing. It's like burning your hand. Your body's telling you, ow, I did something wrong there. It's trying to protect you. So you got to listen, figure out the cause of it, not just cover it up with NSAIDs or pain meds or even just therapies. You really need to truly understand where the spine is. So spinal analysis, know exactly where that is. On top of that, here's what you do. Number one, are you doing the basics that I teach a lot of patients to do the proper warm-up? This is the wobble ball. If you do not know how to do this, kick on over to the wobble ball exercise. This is fantastic to put motion into the spine. Spinal fluid gets it moving, really helps stretch and rehab it. Every morning, every night, just like a toothbrush, that is what you do for your low back. So get motion into it, especially if you sit all day long. So that's number one as far as putting the motion, putting the movement into it. Number two, you would want to do your spinal home care, which is also like a toothbrush. These are more like the retainers. And so your spinal molding rolls, if you don't know how to do these, kick on over to the spinal molding roll video. And your spinal molding wedges, which these are prescribed by a doctor based on the x-ray for your specific spine. Again, there's a video explaining exactly how to do those based on your recommendations. If you don't know what those recommendations are, contact us. We can get you an evaluation or get you to someone that knows what the heck they're doing. So the basics, get those down, number one, and then two other things that you can do. One is the lumbar extension exercise. So you'd sit flat, facing straight ahead, grab your knees. This table's a little bit high, but not bad for your height. You can scoot forward actually a little bit, and then grab the edge of your knees, and then you're going to arch your back and use your knees to pull the curve into your lower spine. Sitting up as straight as you can. You feel that in there? You're forcing extension into your lower back. This can be done at your desk chair at any time, but you're pulling the curve into your low back, holding it, 10-second holds. Remember to breathe while you do it, and you can do that up to 10 times. Great way to force a curve in your lower back. Most people, again, most, not all, have a loss of lumbar curve. That's a way to put it back in. So the lumbar extension exercise, and then finally, work on the core, work on the abs. A lot of people get told that. And what you need to do is kick on over to our 10-minute workout. If you don't have access to that, just comment below on this video or get a hold of us. We can show you how to get access to it. And we have several 10-minute workout ab bonuses that you can do a couple minutes, 2 minutes a day to strengthen your core and really get that solid. If you strengthen this, it's going to loosen all the tightness that you have in your lower back. So focus on strengthening the abs, strengthening the core through the 10-minute workout. So your at-home equipment, your stretching, and then your strengthening are the steps to have to really address a low back. If you're beating it up, it's going to tell you that it hurts. That makes sense. The body should do that. If you take better care of it, you'll actually get it healthy. There you go, low back solutions.